with us for the briefing meeting. Let's quickly review the agenda. We're going to get a COVID update. We're going to have a garage facility update, substance use disorder, behavioral health collaborative grant discussion, discussion of the collaborative mobile medical assisted treatment team grant, and then we're going to have interviews with, I think, 3 organizations related to the American Recovery Act funding applicants that we had some follow-up questions with. Are there any other items commissioners want to have on the agenda for our briefing meeting? All right, if not, that'll be our agenda for this meeting. Any questions about the agenda for our meeting at 5 o'clock? Just one item. We had interviews with applicants for the new ad hoc revaluation subcommittee. I want to thank everyone who applied for that. We had great applicants for it. And I think there's interest on the board in revising the resolution so that we could appoint one additional at-large applicant. So when we get to boards and commissions this evening, if there's agreement by the board, it'd be appropriate to have a motion to amend our resolution creating that subcommittee so we can appoint one additional at-large member. And then if that's approved, we would then go ahead and make the appointments at our meeting tonight. All right, very good. Well, let's go ahead and get started with the briefing agenda. And we're going to get started with a COVID update, and Stacy Saunders is here to help us with that. Thank you for being here, Stacy.
Thank you all. I will try to be as brief as possible because it does look like you have a very large agenda. So thanks so much for the time today. And I'm going to be presenting our COVID update and our vaccine progress. And then at the end, just give you a little information about some of the infection prevention messaging that we've been doing around fall festivities and holiday types of things. So as of yesterday, we had confirmed 28,320 total cases of COVID-19 in our community since the pandemic started. And in the last week, we added 282 new cases. We have experienced, unfortunately, 425 now deaths of our neighbors related to COVID-19. Our current metrics do continue to show promise, so I am here with some good news. The case rate has dropped to 107, and that's down from 119 the week prior. The rate of decrease in cases actually has slowed slightly in the last 2 weeks, still leaving us in an area of high transmission. So that's why you're seeing that case rate still in that blazing red color. Our percent positivity currently, as of yesterday, was 4.7%. This is the first time that we have seen that under 5% since July. So that's good news. I will just caution that we're likely to see that bob up and down a little bit in the next few days, maybe coming in and out of that 5% area, and then hopefully stabilizing by next week. And so, as I said, that's a welcome sight. Deaths actually increased since week prior. We actually had 7 new deaths of our friends and neighbors and family members that were reported since previous week. This results in an increase in our death rate from 1.9 last week to 2.7 deaths per 100,000. The hospitalization rates remain encouraging, and they remain low and stable at this time. So the big takeaway message right now is that we do continue to see improvement. That improvement or that decline in the surge is happening a little bit slower than the rise in the surge occurred. And you'll see that when I show the next slide. And that means that we remain in the space of high transmission right now. So for our community members who are listening in, please don't let your guard down right now. COVID-19 is still abundantly circulating in our community. And so, as we usually do, I'll talk quickly about recent case distribution. This slide actually shows that slower decline that I was talking about. You'll see with our Delta surge, that was a rapid and steep increase in cases. And then coming off the other side of that, it's a bit slower. We actually plateaued at the top for a little while, and then it's coming down a little slower, like almost like stepwise. So that's why we're seeing that case rate just continue to stay in that high. Cases across the board, however, are decreasing. The greatest proportion still remains in our 25 to 49-year-olds, and this has been generally true throughout the pandemic, as this population tends to make up the bulk of our workforce and typically has more potential for interaction and exposure. Our 0 to 17-year-old age group actually saw a decline in the proportion of cases. They had been around 26% of all new cases, and that fell to about 21% in the last week. And then just a quick note to look at the overall vaccination rates. We concluded our 30-day vaccination push on October 26th. During that 30-day vaccination push, Buncombe County HHS administered close to 650 first doses. And in total, HHS administered almost 3,400 total doses, and that's first, second, third, and boosters all together during that time period. We did see our vaccination rates increase in all age groups during that time, with the greatest increase in our 12 to 17-year-olds and our 18 to 24-year-olds, which increased in each one of those groups. They each increased by 4 percentage points during that last month. So I just want to say thanks to all the efforts of our Buncombe County team, both at HHS, at Emergency Management, and our extended team for all that work. So right now, at about 71% of our eligible population has received at least one dose of vaccine. So now I'm going to switch over and move from data into vaccine operations, just to give you an idea of the progress that we've been making in our efforts. So we began providing Pfizer boosters on September 27th, and then followed by Moderna and J&J received their recommendation for boosters on October 22nd. And just a reminder for folks who are listening that Pfizer and Moderna boosters are recommended 6 months after your second dose for those who are 65 years and older, and those who are 18 years and older who live or work in a long-term care facility, have underlying health issues that put them at higher risk, work in high-risk settings that increase their risk of exposure, or folks who live or work in congregate settings that might include things like our homeless or rescue shelters, our detention centers, our migrant farm housing, and even dormitories. And then the J&J booster was actually recommended 2 months after the initial dose for folks. The Biltmore Church booster site, we did sunset that on October 22nd, and we've been providing all doses, first, second, third, and boosters at our 40 Cox location as we gear up for the 5 to 11-year-olds. So since September 27th, when boosters were recommended for Pfizer, we've administered 2,283 total third doses or boosters of any type. And so the reason you're seeing it as third doses and boosters is the state system where we put in all that information around vaccine doesn't separate third from booster, so they're kind of put together. And I wanted to share a little bit of the progress toward the 5 to 11-year-old vaccination. The FDA did provide emergency use authorization last week. The ACIP, which is that Advisory Committee on Immunization Practices, is meeting today and tomorrow. And the 5 to 11-year-old vaccine discussion is on the agenda. When ACIP makes their recommendation, it must be followed by the recommendation of the CDC director before it's officially recommended. Usually that happens fairly quickly, but could take up to a day or so. And then we'd be waiting for North Carolina Department of Health and Human Services to be sending the standing order for us to be able to then administer. And as we await the recommendation, we continue to fine-tune that planning for this age group, including planning for pediatric administration with our staff, providing the training to our staff, preparing the clinic for adolescents, and working toward implementing ready to implement a standing order when we get it. We'll be modifying our operations at 40 Cox beginning November 8th. We'll be switching to a Tuesday through Friday, 9 to 4, so that we will be allowing for Saturday outreach operations for our vaccine team to be able to go out on Saturdays. We have been actively planning those Saturday at school outreaches. The first one will be at Asheville Middle on November 13th, and November 20th at North Buncombe, December 4th at Irwin High, and December 11th at Owen High. And then off to the right there, actually the second bullet point there, that we have been really fortunate in this region to have a national resource being the FEMA vaccine team. They were scheduled to be discontinued on December 1. We've received an extension until December 14th for that team to stay in Western North Carolina. And so that's an added bonus for us in that our team had really wanted to do up to 6 schools, and we really only had the timeline for 4. So our FEMA partners, with the help at MAHEC, who are coordinating the FEMA team, are going to add on 2 more of those schools for us on December 4th and 11th. The locations are to be determined at this time, but that's going to be happening as well. And then I just wanted to add, as far as 5 to 11-year-olds, North Carolina Department of Health and Human Services is also going to have essentially a family vaccination site. They're going to have about 10 to 12 across the state. We are going to have one here in Buncombe County. It is going to be at the Eddington Center on Livingston Street here in Asheville. It will be staffed by the state vendor StarMed. I do not have hours of operation yet, so those details are still being worked out, but as soon as I have those, we'll be sharing that as well. And then as far as communications for our 5 to 11-year-olds, as we approach this eligibility, we've been communicating with several stakeholders, including our communication to schools in our planning efforts for the outreach events, but we also will be planning sort of a short session Q&A with our public, private, and charters on November 8th. We've been doing our vaccine communications to area pediatrician and family medicine practices, giving them information about CVMS, which is the COVID vaccine management system that the state has, and Vaccine for Children program. And as we get the additional provider guidance, we'll be sharing that with our providers as well in the community. And then our vaccine information to parents and caregivers. We do have a parent town hall planned for November 9th. The info is at buncombeready.org. We are planning for our outreach events to be a warm and welcoming environment for this particular population, placing them in familiar and trusted spaces for families, especially the children. And you might remember we conducted a focus group to sort of get an idea of what would be the things that sort of like how folks get their information, or what would be sort of incentivizing to them. And what we found when we conducted that focus group with older children, what we found is that they valued an experience or quality time over a monetary type of incentive. So based on that survey research, our team's been working with area attractions and partners to identify if there's a possibility to do an incentive or some type of giveaway that provides an experience that brings friends and families together post-vaccination. So more to come on that one. And as always, just want to take a moment to remind folks who have not gotten their COVID vaccine to please consider to do so. There are numerous locations within our community. You can check out myspot.nc.gov. And it's also time for your flu vaccine. So many of the same locations that are administering COVID-19 vaccines also have flu vaccines. So please protect yourself this season. And as I said earlier, COVID-19 is circulating widely around us in our community. It's actually the most predominant respiratory illness right now. So if you are having symptoms, any of these symptoms that are listed on the slide, please get tested. This is not the time to shrug it off and think that I just have a cold. This is the time to confirm and be certain that it's not COVID. So go get tested. And there are several testing options in our area, and you can find them at Find My Testing Location website, or you can visit Harrah's Convention Center Monday through Friday, 10 to 2, where the state partner StarMed is also testing individuals. And while, of course, vaccination is our best tool to prevent illness, if you do contract COVID-19, please be aware that monoclonal antibody treatment is available. It's available to those who have had symptoms of COVID-19 for 10 days or less and have been exposed to COVID-19. If taken early, it can reduce the risk of severe disease, hospitalization, and death. And you can find a location for monoclonal antibody treatment at covid19.ncdhhs.gov/find treatment. And lastly, just some infection prevention efforts that I wanted to share around what our team's been doing. We're working with fall holidays and festivities. So we did release several Halloween messages this year, helping folks put simple measures in place to have a safe and healthy Halloween. I want to thank all the parents and the kiddos who did end up practicing those measures during their trick-or-treating. And then our comms team also has created a helpful guide to other fall events like Thanksgiving as those are approaching quickly. So I just want to urge everyone in this space and who are listening to us on streaming to please be thinking now about how you want to make your family gatherings safe and healthy this year. And as we continue to release messaging, around all of our fall festivities, we also continue to message around the 3 W's, particularly as we've extended our face covering requirement in Buncombe County through November 30th. These added layers of protection and thoughtful approaches to our upcoming holidays can help us prevent the spread of illness and hope to help dampen any holiday case surge that we may see. So that's it for me. Thank you all so much for the time today.
Thank you, Stacy. Commissioners, are there any questions at this time? All right, thank you very much. All right, next up is an update on the new garage facility, and Michael Mace will present this item.
Okay, Commissioners, thank you. We are building a new building out at our landfill. It's going to be a new general service complex. It's going to house 3 current, let me back this up. Sorry about that. There we go. So it's going to be handling 3 of our departments in general service, which is the fleet service, maintenance and construction, and our grounds division. This building will be roughly 22,000 square feet, has 10 bays, combined storage for 3 divisions, and also the room for all of our supervisors, maintenance techs, and all that. So here's the concept elevation view of the county fleet service building. As you can see, this is just the side view of the conceptual drawing. So we do have the high performance building resolution, which was adopted back in September of 2020. This will be the first time we've used this since this is a new building. Key points for that, the resolution were to achieve LEED Gold, the emphasis on net zero. We are not required to have certification, so it's totally up to us if we'll certify the building or not. This building will generate less waste and use less electricity. Of course, we're working with architects and engineers and firms on how we're going to achieve the LEED Gold. We do know the building will come with solar ready. It'll also be EV ready. We'll be working on waste management as far as water consumptions and the high-energy efficient HVAC systems. According to this resolution, we're going to come back to the staff, come back to you, the commissioners, and present to you a life cycle analysis. So here's the tentative timeline. Those were the conceptual drawings that I just showed you. Life cycle cost analysis, we're going to come back to the Board of Commissioners in January. In February, we're going to go through the drawings and plan reviews. In March, we hope to bid this out, and in April, we'll start construction. Any questions?
All right. So, Mike, on
Yes,
the, I think the presentation said the plan is to actually install solar on this
That's correct.
building when it's constructed, as opposed to just sort of designing it for, but,
That's
so that's the plan, but you're going to do some additional life cycle analysis and bring back that information for us to look at?
That's correct.
Sounds great. All right.
Thank you.
Great presentation. No other questions right now. And next up, Stony Blevins is going to talk to us about the Substance Use Disorder Behavioral Health Collaborative Grant. Thanks for being here, Stony.
Sure how to get PowerPoint Max. There we go. Good afternoon, Commissioners. I'm Stony Blevins. I'm your Health and Human Services Director, and I'm really excited today to bring you a wonderful opportunity being presented to us through Dogwood Health Trust. And this opportunity really comes on the heels of a recently formed Behavioral Health Justice Collaborative, which is a work group of the Justice Resources Advisory Council. And the departments that are working together in this collaborative effort are HHS Social Work, HHS Public Health, Emergency Services, our Justice Department, as well as the Sheriff's Department. So it's really an exciting interdepartmental kind of integrated approach. As you know, after the announcement of the historic $26 billion national opioid settlement, we began to start doing some initial planning here at the county. Shortly after that, Dogwood Health Trust invited counties to apply for funding through the foundation to do planning grants on how they might utilize their opioid settlement funds. And the parameters around these funds were to either facilitate or coordinate planning, to conduct needs assessments, data collection and analysis, to promote partnership building within the departments or across the county, to develop the implementation of plans to sustain funding, and to promote capacity building. So when we heard about this opportunity, we got together and we jumped on it. We decided to submit a grant. It was a pretty short turnaround time. And just to give you an idea of what happened, on August 31st, we submitted our grant. And we requested just under $500,000, which would be awarded for a 2-year period. On October 19th, we were notified that Dogwood was willing to grant our full request. And so we were very excited about that. And then if we were to receive the funds, they would begin in January 1st of next year. What we would decided to do with this money is really to hire 2 positions to focus on this countywide, sort of an enterprise level positions. One would be a behavioral health manager, and that person would be responsible for leading the collaborative, for working on the integration of all these various department projects and multiple grants with sort of an integrated whole person, whole county approach. Would also do a lot of community work and send our message out into the community. The data analyst, the behavioral health analyst would work alongside this person and do some project management, some deep assessment of needs, look how programs interact and intersect, also be our data manager for the project and build appropriate data dashboards. So what we hope to do really is coordinate and integrate existing behavioral health services. I'm so proud of Buncombe County. It's amazing to me since my arrival in early 2018 what we've accomplished in this area around substance use disorder and other behavioral health challenges, and then to create a sustainability plan for these current efforts, and also what I would call an expansion plan or an innovation plan about how we can build on our success and continue to grow. We'll also collaborate with community partners in system-wide efforts. We're doing some of this work. I think about our CARE Coalition, which is made up not only of partners, but of private citizens who meet to discuss opioid and other substance use disorder efforts. And then we will certainly track and analyze data for successful trends with an equity lens, which I think really flows nicely into our county strategic plan and the efforts that we're making there. So next steps, we'll bring an action on November 16th, asking the board to accept the award from Dogwood Health Trust with a budget amendment, to also add these 2 FTE positions and appropriate the funds. After that, if we are approved, we'll begin an immediate competitive recruitment and selection effort. So hopefully we could have a person, these 2 positions on board shortly after the new year when the funds arrive. And then we will just continue in that planning that is already going on and develop a robust opioid settlement funding plan to bring to the commissioners, late spring, early next fiscal year when we anticipate those funds might actually be released. So any questions?
Just to say, this is tremendous news, and thank you so much to the staff who worked on this, and it's just incredible to have this level of support from Dogwood for a position like this, especially in this moment. It's exciting to see that roadmap and timeline up ahead, and as we get closer to where we'll be beginning the planning process around opiate settlement dollars, I've been on a number of calls this past week around it. I know we're getting closer and closer to that date. It would be great to have some opportunities for community input in that process. I imagine y'all are already envisioning that, but maybe we can just sort of start floating some of that so community members can start to get this on their radar screen. And again, just appreciate the tremendous work and responsiveness to the opportunity of this moment.
Thank you.
All right, thank you, Stoney. Great job. All right. Next up on the agenda, got Taylor Jones, who's going to talk to us about the Collaborative Mobile Medication-Assisted Treatment Team Grant.
Good afternoon, Commissioners. I'm here today to share some great news with us about a $500,000 award from Dogwood Trust. If approved, accepted by the Commissioners on November 16th, these funds will be used to fund the expansion of our community paramedic team to include Medicaid-assisted treatment. It will also provide a peer supervisor that will work with members of the community to actually perform collaborative outreach. We want to perform treatment in crisis with an increase in linkage and enrollment into rehab services that could decrease the deaths from opioid overdoses, leading into the follow-up of y'all's strategic plan to eliminate deaths in the future. Just kind of an overview of our cost analysis laid out on what will be used with the $500,000. When we talk about our sustainability, is based on our current landscape. The funding options are we can apply for Dogwood Trust. They've encouraged us to seek funding in their next cycle for continuing discussion around this. We've also got potential funding out to the board through the American Rescue Plan for adding a emergency services homeless outreach team that would concentrate on linkage of care with the homelessness population in our community. And we've also got a request out for a command post and an air truck to support our fire departments. Depending on the results and the data from our MAT pilot team, we may request funding in the future through the opioid settlement and this expansion, and that will go hand in glove with what Stoney just spoke of that whole integration and working together as a collaborative here in our community. So our next steps, if the board approves on November 16th, we will ask for amendment to add positions and appropriation. We'll provide program implementation and evaluation with program reports and updates annually to the board on our progress and the data from this program. We think this program is going to align nicely with MAHEC's Buncombe Care wraparound services. That is also a project that they've got preliminary funding from Dogwood Health. And it really kind of speaks to the community coming together in an outreach program. I'd be remiss if I didn't speak to the $100,000 that we've aligned in this for our community partners so that we can actually get peer support that will work with that peer lead from a community lens and level to bring more equity into our program and more diversity from a community level of folks that deal with this care on a daily basis and make them part of our MAT outreach. Any questions? Thank y'all.
Yes, actually, I do have, thank you,
Yeah,
Taylor. Well, first of all, thank you for your good work, and I do just have a couple questions. One thing is, can you speak more to the nonprofit support, the 100,000, and talk a little bit more about that? And then the other question, because I know we have a paramedic shortage, and we're going to be addressing that, and I'm just curious how, because we're going to need more paramedics for this, and I'm curious if you can speak to the impact on that shortage and then the hiring plan with this going forward too, because we know that's a critical area for us.
Okay, certainly. So one of the things that's first and foremost we've had a lot of community partners that's been involved in our Code Purple response and to our outreach with behavioral health services and the MAT. And so what we're envisioning is to take, there's many agencies in the community that are working peer support level, and we encounter that work every day with our community paramedics. And so one of the things that we hear back from their level is being able to fund enough people to work with us. So one of the things that we do with MAHEC is once a week, we have a resident psychiatrist that actually rides with our community paramedic team. And during that week, it's always like that one day a week, it's like an explosion of activity because we can link all those people together and actually connect them to the right services at the right time. So what we're hoping to do with these partners is to bring in more of that linkage of care and work more from that side. We're also having discussions in the future with RHA from actually providing that mental health counselor, embedding that with the community paramedic so that we're using those services more efficiently, and that doesn't have to be another cost onto the county that we would, So a lot of conversations going on at the grassroots level to actually make that happen. To the point about staffing, it's kind of like turning a water faucet on. You can't just turn it on wide open. Right now, we're in good shape in a lot of ways with our amount of staffing compared relatively around North Carolina. I was recently in the last few days talking to a similar county, similar size, about 100 miles from here in North Carolina, and they were down 31 paramedics. Right now, we have 5 paramedic in EMT openings for full-time slots, and we have 6 in the pipeline. So when we get through the hiring process next week, we'll have all those positions filled except for some of our part-time. Now, is there a constant, turnover? Yes, nationally there is, but Buncombe County has only experienced 5% turnover. In our request and what we're trying to do is really get ahead of where a lot of places are in the moment and not having enough staff not having enough staff to meet the increase in call volume. It's really not having enough people that plagues us right now as the issue of we having an increased call volume that has put a higher workload on those folks. So what I'm hoping that the community paramedic program does is we slowly hire people and integrate them into the system. At the same time, we're bringing people in on the peak truck side from the request later on tonight, is to make sure that there's a balance reached, that we're decreasing our opioid, our behavioral health type calls, our overdoses, that trend continues with giving treatment to people in the field while they're in crisis. Because a lot of times that hunger for that drug returns, and that same EMS crew is seeing that patient 3 and 4 times during their shift. And they're never going to the hospital. They're always waking up after the treatment and refusing the treatment or further transport to the hospital, which leaves us kind of in a library situation at the county that we got a patient refusing services and we're not able to transport them. So our hope is that community paramedic is going to be able to stay with that patient, bridge them to care, and connect them to long-range care, and therefore, over time, eliminating our overdose deaths, the amount that we continue to have in the community. We have seen with the pilot program a decrease in 5% in this area, where the rest of North Carolina has went up 40%. So we know the program's working, and we know the benefits of it. And it's going to be one of those things that we got to continually adjust and balance as we move ahead because of our paramedic shortage. And that's why having these extra requests that we're coming to the commissioners for, really aligns with this plan that will decrease our overall call volume and also provide much more needed assistance and improve our response times in the community. Does that answer your question? Thank you, Commissioner Wells, for that question also.
Just want to say quickly, I'm really glad you brought up that stat about the data that we're seeing, and I hope this is something we can keep talking about, but it's just really tremendous that there is this decrease happening around overdose deaths in Buncombe County, a 5% decrease, and in so many other places we're seeing the numbers head in the other direction. And I think, at a time when there's been a lot of bad news, is something to really take note of and appreciate the work that's happening on the front lines. And I would say, from the work you all are doing to the targeted work the sheriff's office is doing around, targeting larger suppliers. I think we're really starting to see some of the impact of the investments and priority we placed on this in Buncombe County show up in lives being saved. So just want to thank you and your staff for that, and also hope more folks in the community are tracking that as well. This is a lot, many, many years of work going into starting to see some results and shifts like that.
Commissioner, thank you for that. And I really want to take this opportunity to praise what the detention center is doing, because that data there looks fantastic. Seeing the actual connection that the peer support at public health is making. I mean, they've actually put in over 500 patients during this pilot program into rehab. And of that 500 patients, we've seen less than 30 that's actually dropped out of that program. So, the data and the information on that, I think when we mix that with the MAT treatment that's going on in the detention center with what's going on in the field, we're going to see this start to turn around. I'm very hopeful of that as we move forward, and I just really can't tell you how much y'all support behind this, and Dogwood Health Trust, their support behind it financially. I mean, everybody's kind of coming together to make the right things happen at the right time, and I appreciate y'all and commend y'all for that support.
Taylor, thanks so much. We appreciate the update. Great job. And appreciate the support at Dogwood, too, for both of these, support in both of these programs that we were just discussing. All right. Next up, we're going to have a discussion about several proposals the county's received under the Federal Recovery Fund, and we had some follow-up questions with some of the applicants who had submitted proposals. Rachel, do you have anything to share to kick us off on this? Or just want to get oriented on this?
Good afternoon, Commissioners. Rachel
Good
Nygaard here. Happy to provide some context and orientation for this. So this is part of the overall state and local fiscal recovery fund process that Buncombe County has been going through. As a reminder, the first round of awards was made in late August. And since then, commissioners have been gathering information from the community through community input sessions and gathering information through written follow-up questions to some applicants, through public comments from all applicants. And today you're hearing from presentations from 3 organizations that submitted proposals that are related in the small business support space. We're going to hear from CityWorks USA, the Black Wall Street Initiative, hear from Eagle Market Streets Community Development, and hear from Mountain BizWorks, specifically the Mountain Community Capital Fund. Each organization is prepared with a brief presentation, and you'll have time built in for questions for each. Thank you.
Terrific. Thanks, Rachel. And thanks to each of the organizations for being with us today to talk a little bit more about it. The fact that we wanted y'all to come back. All the different applicants gave very short overview presentations. Anyway, this is an indication that these were proposals that the commission was interested in and wanted to kind of take a little bit of a deeper dive on and maybe have a little bit of some time to have some discussion as well. So I think, Rachel, you said that we're going to start off with the Black Wall Street Asheville proposal. So thank you all for being with us today. Yeah, and as Rachel said, if y'all would like to, we'd love to hear a little bit more detail about the proposals. And then I think for each organization, there's a couple of different questions that commissioners were interested in asking and having some discussion about.
Good afternoon. I am Jay Hackett, and this is Bruce Waller, and we're here to discuss the Black Wall Street AVL project. Thank you for this time and opportunity. Our goal is to establish an effective Black business incubator. Black Wall Street has found a great opportunity in preparing Black-owned businesses to generate revenue while engaging with the growing tourism industry in Buncombe County. In July, the BCTDA approved a $20.3 million budget with $15.3 million going towards advertising and public relations efforts. However, only $123,178 goes to community engagement. This creates a potential gap where the BCTDA is working hard, really hard, but may have a blind spot, not being able to attract BIPOC people to the county because of a lack of knowledge or a lack of themes and activities that would draw the Black population. Since the time of our initial application, we've learned even more about the impact of tourism on our county and partnered with the BCTDA to explore opportunities and strategies to engage more Black-owned businesses in the tourism industry, making the projected growth more equitable for everybody. In short, we've discussed what can be done so that Black businesses can benefit here in Buncombe County. And so today's presentation speaks to that specifically. In line with their marketing recovery framework goals and all the time and energy they spent on marketing, we learned that these goals are to inspire interest, build brand equity, support community partners in the road to recovery, and generate a broader travel throughout the county. Now, they target folks aged 25 to 65 with an average income of $75,000. However, we still have, number one, a lack of BIPOC visitors, and then number two, locals that are not motivated to invite folks because there's nothing here for them to do. The Black Wall Street Project is a step in the right direction to help close that gap. So we dug into this gap in our ecosystem and found that over half of the businesses in the Black Wall Street cohort are living on less than $25,000 a year as individuals. Now, this is not a surprise considering the average median income for Black folks in Buncombe County is $26,000 compared to $46,000 for white people. But the Black business owners lack the startup inventory to build their businesses and to engage with the growing tourism industry. So in following the marketing plan of BCTDA, we use it to actually target BIPOC communities within a 6.5-hour radius. The city of Asheville just provided us a building at $1 a year, adding to our sustainability as a program. And this one-time grant fund that we're requesting would help Black businesses recover by purchasing inventory from local Black businesses for the cohort, furnishing the building with attractive sales displays, family-oriented outdoor games, and making this a cultural destination that both the county and the community can be proud of. There's great opportunity here for everybody. And the request that we have for $250,000 goes to $50,000 for the director's salary, $75,000 for a food truck or trailer that would be there in the River Arts District that Black business owners could use and share, $25,000 for retail furnishings, equipment, and signage that fits the aesthetic of the neighborhood, $75,000 for purchases from the Black Wall Street cohort, including Black Wall Street Jr., and $25,000 for marketing so that we'll be able to target locations that are outside of Asheville and convince them to come here for our events. So some Black businesses are going through dire straits in order to launch, in order to build, including people that are, on food assistance, and they might be a good cook, but they're using some of their funds to purchase food so they can sell it. And now our program partners are part of the business development community here already. Mountain BizWorks, Eagle Market Street, even Western Women's Business Center, they're all part of our network. We refer to them, we've learned from them, and they funded part of what we're doing here at Black Wall Street. And so we're seeking this funding to have a good jump start. This one-time funding would really help set the stage for the future of Black business in Buncombe County. And you see our presentation.
As you refer to the slide, the main thing that Black Wall Street will be doing is filling in that gap piece where there's a lot of already institutional knowledge and anchor institutions already supporting a lot of this work. We are there to come alongside all the Black businesses that we work with and carry them through all the different work that we do. So as we go through this really quickly, the impact of COVID on Black businesses, we already see that the detriment on that, what has happened with last year. We want to make sure that we are supporting Black businesses that have been impacted by COVID. And we have a lot of partners and sustainability models set in place, especially when we found out about the new building, getting the building for $1 a year helps with that sustainability. We are nationally recognized by 4 magazines for the Black Wall Street. Oh, okay. The Black Wall Street generated already, what's different now is 391,000 is actually 600,000 plus in economic impact that we already had. We served over 9,321 customers. We created 10 jobs. We are awarded also attracting more diversity in the River Arts District when we did the Grind Fest. And these are some of the other partners that we have. With that Grind Fest, we have 4,000 people that have already came out, 36 sponsors, and over 19 states represented. So the visitors spend $2.2 billion a year. As you can see, the different categories that visitors spend by category and Asheville visitors top 5. We can see that the ones that we are targeting, which is culinary experience, historical place, and cultural activity places, that's already a $1.36 billion what we are targeting as far as in the percentages here on the screen. And a lot of the work that we're doing is targeting those 3 things where visitors are coming in and locals. We have a little bit more, everything is growing as we go, but 57 Black businesses are represented in the Black Wall Street cohort. As you can see the different numbers, as Jay was saying, half of them are under the less than $20,000 category from our data that we have captured. 20 out of the 57 are men and 37 out of the 57 are women, and it continues to grow. Alone, we can do so little, but together we can do so much. We have a lot of recognition and partners. As you can see, Eagle Market Street, NC Idea, Venture, Asheville, Hatch, Mountain BizWorks, Aisha Adams Media, Rotary Club, and so many partners and so much support from the community and also on a national lens as well. This model that we're building has a lot of support already locally and also regionally in other parts of the country. The gap between what we have now and what people need is that there's a lot of resource out there already. Our job is to connect them directly to the support out there. So Mountain BizWorks, Eagle Market Street, Western Women Business Center, and so many other partners already have a lot of things out there. We just want to make sure that we connect them directly to resource. And so we mentioned about the dollar a year that we have, that actually saves us $18,000 a year for the next 10 years. And so that savings will help us fund for other projects and strategic opportunities for the good of the Black Wall Street AVL. Moreover, the permanent building will help build the market to gain more sales, given the high level of foot traffic in the area, which will expand their business horizon. And of course, we're doing the Black Wall Street Junior. This is most definitely near and dear to my heart, we'll have funding in place to help them with their dreams and ideas.
Overall, we intend to contribute to the economic development of Buncombe County for everybody. Our request is a bit time sensitive. Projections show that this shopping season at the end of the year is going to be one of the largest in history. And it would be great if Black businesses were positioned to take part and sell their products and services for the people that are going to be visiting and the people that are going to be engaging with them. Thank you.
All right, Bruce, Jay, thank you guys so much for being with us this afternoon, and for taking time to take a deeper dive on this proposal. Commissioners, questions? I've got a few, but does anybody else want to get started?
Yeah, first of all, congratulations on your building. I'm sure that was very exciting and will be very helpful. And can you speak some more to the job creation aspect?
Yes.
Talk about that part specifically, please.
So one of the primary purposes of Black Wall Street in the world of entrepreneurship is to create jobs. And so we meet every Monday night, and our first goal is to generate revenue. So we encourage people to sell their stuff to generate revenue with the goal of hiring themselves. So creating a job first for themselves as a business owner. Now, some of the people, they are working or not yet working, and they were able to create part-time jobs. A few of them were able to create jobs for themselves. And when we calculate as a cohort as a whole. And so this number reflects the number of jobs that have been created inside the Black Wall Street cohort since January 1. And it's actually a bit higher now. It's 12 jobs this year.
Excellent presentation. One question, though, I have. Why are you spending $25,000 for marketing when the millions that tourism and development are spending? Why can't you all piggyback on with them?
We number one, we don't know how. But number two, BCTDA, they have been great partners and very supportive. The support they give us is a lot of information. And this year we did receive funding from them for the festival. The specific type of marketing that we're talking about is when Black folks can go to the markets that the Tourism Development Association would have normally gone to, and they're going to them with millions of dollars. But it does take somebody that understands the lingo and the vernacular and can speak to groups and knows where those pockets of groups are. Historically Black organizations, Black business communities and groups, and we want to be able to go and have the funding to go and say, y'all should come to Asheville for this, y'all should come to Asheville for that, and not only the BCTDA send their folks out in the way that they normally have done it.
The reason I said that, I have a lot of friends in Atlanta area, and we get a lot of people from the Atlanta area who visit here, and they have seen it through, the tourism. But I hear what you're saying. You need to get to everybody and get down to them. But when you look at really a lot of the people who can afford to come to Asheville and who are African American,
Yes, sir.
they see the tourism ads. I have buddies all over the country who are coming here now. As a matter of fact, in June, we'll have my family reunion will be here. But it's a lot who come in. But I just want to make sure, though, that you take advantage of the tourism money, too, because, we need to make sure we get to everybody.
Yes.
And 25,000 is good. But that's peanuts when you look at who you need to get to. Yeah, that's all I'm,
Thank
trying to help.
Thank you. Yes, yes.
And actually, I have one more follow-up question on the jobs created. Can you talk some more about the types of jobs that you're getting created?
Yes. So the jobs that have been created, one is manufacturing. So it was a cosmetologist that no longer does hair, but started doing manufacturing, actually making the hair products. Another job that was created was a marketing associate job. Another job was created. Now, some of them were created inside of Grind, so they're barista positions. And there was a job that was created about 2 weeks ago. A person, they ended their full-time position and went full-fledged hiring themselves in their image consulting business. So these are just some of the jobs that have been created. Mhm.
You know, talk more. I want to hear more about what you're doing with the young people.
So
'Cause that's what got my ear, yeah.
in the winter of last year, in a partnership with My Daddy Taught Me That and Black Men United and Grind, we had, as a coffee shop was opened in the middle of the pandemic, and we were just thinking of what can the Black community do together. In October, we held the Black Man's Response to the Election, and out of that, and that was actually a group of 25 young people that had a discussion about what can we do as a community. In that session with 25 young Black men under age 18, they said we want to start businesses, among a few other things. And so in November, we planned it. In December, we launched the Young Black Entrepreneurs Wrestling Champion Titus O'Neil came. My Daddy Taught Me That led the whole thing, supported by Black Men United and partnering with Grind. And so at that point, young Black entrepreneurs started selling and testing out things, and we began to call it Black Wall Street Junior. So all throughout this year, we've had young people tagging along, but what we want to do is actually put a primary focus. Separate from the entrepreneurial energy that's going on, Buncombe County has noted the need for diversion activities. And in those conversations with young people, they still saying that we want to start businesses, we want to do something, we want something productive that put money in our pockets. And so, again, with the partnership with My Daddy Taught Me That and Black Men United, in addition to United Way, in addition to Asheville City Schools Foundation, there's one other organization, I'm forgetting who they are. My Daddy Taught Me That, Asheville City Schools Foundation, United Way. We designed the Black Wall Street Junior program. We're ready to kick that into overdrive.
Good.
Yeah. And one of them just turned 18 last week.
Yeah.
And his book is already in print, and he's filing his LLC paperwork as we speak.
Great.
Hey, I had a couple of questions, just kind of first high level. So and again, also congratulations on the decision with the city to support the use of the property for this purpose. And did the city, I saw the story in the paper that was talking about this, and have the city council formally agreed to the $1 a year for that number of years? I heard they awarded it to the organization, but have they made the final decision around the terms?
It has not been ratified yet. What they did, we had proposed to pay market rate, and they decided at council to amend it, and they agreed on that amendment. There's a notice period, and then at some point at the next meeting, it'll be
Formally
Yes.
approved, but, okay. All right, great. And in terms of the space itself, is, you're talking about, visitors coming for the holidays and beyond. Is the property itself envisioned as like a retail location for various organizations that are affiliated with, the initiative? I wasn't sure if it was more like a retail space or more like a space for some of the organizations to operate out of. So just describe a little bit more of the vision for like what's happening in the property itself.
It's a retail space
Yeah.
where their items are going to be there to be sold. So the items sold out of this retail space are sourced from the local Black businesses. Separate from that, because we're able to move things the way we can hold events there. And so we plan with one of the local entertainers, Joe Green, has planned a series of Saturday night events. There's, what do you call it, sip and paint, painting event. There are like various community-inspired, fun, family-oriented events that can happen there. But primarily it is a retail space where local Black folks can put their stuff in there, and it'll be sold whether they're physically there or not. Oftentimes, the Black entrepreneur is working a day job and then trying to do their thing at night. And previously, we had success with them selling their items and services in the pop-up shop once a week. But it would be great if things could be sold by them throughout the week, even if they're not there.
Okay, so not like a co-working space, more of like a retail kind of
Retail.
vision for that property. Got it.
And through our partnership with First Horizon Bank, they've partnered to help advertise for the Black businesses all around the Southeast. And they're the 4th largest bank in the Southeast United States.
Now, part of the, I think I was going back and rereading the proposal that was submitted to the county. Part of what the proposal talks about is the organization's function to, in essence, be like a micro lender to different entrepreneurs, right?
Yes.
But that's not actually part of what, like the funds to directly do that, that's not part of what the county's proposal is, one of the uses of those funds. Or is that, I just wanted to clarify that question.
The way that it operates, yes, it is part of it. But when you look at the 75,000 in purchases from Black business owners, a lot of people have an idea, but they don't have the startup. They can't make their first purchase. And so what we would like to be able to do is say, what do you need to make your first purchase so that you can make that first purchase, which is relatively small, but once they sell it, it's larger, and they can, it can just keep going.
So it's like inventory for those
Correct.
businesses who are getting
Correct.
off the ground. Got it.
There was one member of the Black Wall Street cohort that had designed a very, very attractive product. It was, schools like it. It has both a fun aspect to it and an educational aspect to it. Schools like it, but she did not have the money to get her first batch of stuff going, like big enough for it to sell. It was too small to get a loan. It wasn't worth her running her credit for. It was like a gap, and we were trying to figure out that. And that's a pretty typical situation where people just need a little to get started.
Okay. So one of the other groups that was mentioned in the proposal that I honestly wasn't real familiar with was the North Carolina Idea Foundation.
Yeah.
Could you just like talk a little bit more about
Yeah.
what they're doing and what their role is? And
NC Idea Foundation, we didn't know about them. Actually, Jeff Kaplan over at Venture Asheville told us about them right when we first got started. And we submitted a proposal specifically for Black Wall Street, because we were doing the pop-up shops unofficially. And we were like, well, if we can do this, and this, and this, and structure it in a way, we can really do some things. And they gave us $50,000 in December of last year. That was to pilot this. And the goal was to start, grow, and expand 20 Black businesses and help generate a collective $250,000 in revenue. We exceeded that before the first 6 months, and it seems to resonate really well here in Western North Carolina. So they've come alongside as partners. They're supporting, they're making connections for us and with us around the state, and we really appreciate it.
that's great. So part of the funding would allow the organization to hire a director. Could y'all just talk a little about, I mean, this is all still a pretty new initiative, right? So in terms of the organization's development, is this still like a volunteer? Are you currently able to pay staff, or just talk a little bit where you're at sort of organizationally, development-wise?
This initiative is, this year was the pilot. It started in December of last year, and we've tested it out. And we have 68 businesses right now, and it's purely volunteer. And we would like to hire Bruce as the director. He's doing much of the heavy lifting now, and he's doing it all volunteer. And we think that with this one-time funding will allow it to grow and to sustain itself in the long-term future.
Great. I guess just the one other question I had, I mean, and one of the things that we're looking at with the ARPA funds is there's a bunch of rules around it, a whole bunch of, complicated regulations. We make everything, way too complicated, right? So, and there's permissible uses of funds, and there's things that aren't. Some of it has to deal with like nonprofit capital funds, and I think parts of your proposal fall into that category. Other parts might not, but I think those are all some things we've been looking at, not just for your proposal, but for a whole bunch of different proposals from nonprofit organizations. But I think my question there was, it is really complicated from like a federal grant reporting standpoint. I'm sure I'm not telling you anything you don't know, but I just think it's been one of those things where, as we've been looking at different proposals, we just want to, as a pretty new organization, just make sure y'all are aware of that as we're looking at it, just because it is going to be an administrative burden, I think, to some extent, for everyone who receives some of these funds. So again, I'm not even sure I have a question there. I guess I just wanted to say it out loud because it's one of the things we've been really trying to be cognizant of too. But thank you for your answers. Commissioners, y'all have any other questions right now? I don't think I have any other. I think they answered all the questions I had.
Thank you. In consideration of what you brought up, we, as the county has had their information session that we've been learning along the way, part of our intent today was to give more detail about how we would spend, especially the bulk of the 250 that, and we were thinking that it may be more appropriate to spend it on objects, actual items, and that was what we imagined, that if there are things that people need in order to do business, if there are items that need to be purchased in order for them to do business, that might be more appropriate than actual tangible funds going to people. So that was our idea about that, in line with what we understood based on what we learned so far. But of course, we defer to the county for that. Bruce, did you have anything you wanted to say?
Yes, more in particular to the youth. My last previous work was at Asheville Middle School. I worked for United Way for 2.5 years over there, so I have really strong relationship with a lot of young adults. So the Black Wall Street Junior concept is really near and dear to my heart to actually, because I already mentor youth and volunteering, I don't even know, 60 plus hours a week. Just, I'm all in. This is what I'm gonna do. And I think that when I see the young adults, be able to help them translate their ideas into bite sizes and know how to speak their language, no matter what background they are at, I have that. Just feel like I have that gift and that understanding where young adults are, and actually pull them and magnetize them to hire themselves. Versus, I think it's good to have a job and work, but some of them may feel like I want to pivot into, Mr. Bruce, I want to do what you do, or I want to be a co-owner like you, or and being in that position to do that continue to keeps me close to working with young adults, and also partnering up with people we've been working with in Black Wall Street. The younger, so I've been imagined to pair them up with tutors. So for sustainability purposes, because I taught something at Asheville High the other day for their CTE program about business, and a lot of young adults was really inspired, and the teachers were telling me like, this is like their favorite class. Yeah. And so that gives me more opportunity to do things like that on so many different levels, whether it's systematic or just having a conversation with a young adult at a table. And I'm most definitely excited and looking forward to, whatever decision you all make, that most definitely that allows me to continue to do that work and working with the young adults and also the greater Asheville.
Well, that's great. I mean, you can just tell there's a lot of energy around this whole initiative that you can just, it really stands out. And I mean, as you guys know, it's Asheville and Buncombe County is the kind of community where it's not just like opening up the newspaper and looking at all the awesome jobs that you can choose from. Like a lot of people, you kind of build it yourself, right? So I think that's what's really exciting about this kind of initiative, is it's all about inspiring that and helping to make that happen. So congratulations on just building all the momentum and energy around this that you have so far. And thanks for taking time to be with us today too.
Thank you.
Any other questions right now? All right. Thank you, gentlemen. Appreciate it.
Thank you.
All right, and I think Eagle Market Street is going second.
Thank you.
Good evening, Commissioners.
Good evening.
Thanks for having me. My name is Stephen Lawrence. I'm the fund manager for the Community Equity Fund. Speaking on behalf of Ms. Stephanie Twitty, who is unable to be here today. She had provided a slide deck that all of y'all have probably seen multiple times through this process. What I would like to do is go through some bullet points here, and then answer questions if that's okay with you guys. So for the past 27 years, Eagle Market Streets has been consistently supporting small business development through their individual development account and their commercial incubation programs. Most significantly, and most recently, the Community Equity Fund, which was the inaugural cohort. We did our first round of funding in July of this year. We were able to put $200,000 back out onto the streets to BIPOC businesses. And of those 3 businesses, there were 13 jobs created, which is saying a lot. In one particular business of the 3, because of the funding, was able to respond to an RFP with the Forest Service for trail maintenance, which is going to potentially provide an additional 15 jobs. So with an investment of $200,000 out the door, we're looking at potentially 28 jobs. Another one of the businesses is looking at the opportunity to expand to another location and have a second location in another county. So the whole piece that glues this particular program together is allowing intergenerational wealth to be created with BIPOC businesses by creating jobs or market share, which also leads to the creation of jobs. Eagle Market Street Development Corporation's Community Equity Fund is an innovative and novel approach to offering small businesses who are ready to scale, and they have to be ready to scale, an option of equity capital versus debt. The program recruits and enrolls small businesses who have been in operations for 3 to 5 years. So we're not looking for those startup businesses there are a lot of resources that are available for startup businesses, but we're looking for those that have been in business, but they're in status quo. They're to a point where they can't acquire any capital to be able to get them to that next level, which includes the job creation, but they're able to kind of support themselves, if that makes sense. They're kind of on the fence. That's the gap we're looking to flip the script with. And that's where the job creation comes in. All of the funds that we have received have been through philanthropic ventures. The bulk of our dollars we have to date raised $330,260 has come from the Dogwood Health Trust. And within 2 weeks, we had the majority of that money back out onto the streets in the hands of the 3 businesses that I had mentioned. Those businesses have to fully be vetted, just as they went to, as if they would go to a bank, in a sense. But what holds up a lot of small business, BIPOC business owners in particular, and I've got a 20-year background in banking, and I've seen this firsthand. So I've seen patterns, I've seen trends over time. A lot of times what we see is it comes down to collateral, and that's the piece that can make or break a deal when it comes to the question of why don't we just send these business owners to a bank or another, non-traditional type lender. When it gets to the collateral piece, that's where the brakes get hit. And then they don't have access to capital. Whereas if they had an opportunity to have a capital injection rather than debt on the front end, then they have the ability with this program to use that money for 24 months without having to make any repayment back to the fund. The purpose of the fund is for it to be recycled after that 24 months and it's fully paid back, which in turn 100% goes back out to new businesses and continues the sustainability of the fund and the program. We currently have a dozen new businesses that's been added to our pipeline. 7 of the 12 are fully vetted and ready to be funded. The priority with this partnership would be to get the ones that are fully vetted funded as quickly as possible, and bring in as many more new businesses as we possibly can. With those restrictions, being in business for 3 to 5 years, here's where our program is different. A BC bank is going to make you meet a lot of different criteria. The CDFI world is going to make you meet specific criteria. And it's nothing good or bad, it's rules and regulations, like you were talking about earlier, where we have the flexibility of saying to a business owner, we can look at this a little bit differently, and we can see the purpose of what you want to accomplish. And we not only want to give them capital to be able to see them make that happen, but also provide the technical assistance on the back end, helping them with that next level training. So part of this whole program, it's not just about the capital, it's about the next level business consulting program that we have put together and in the process of getting it accredited. So it's a lot of different pieces that helps push this whole agenda forward in the sense that, you know, we provide the capital, but it has to be for a particular purpose, and that purpose has to be with the intent of scaling that business to create jobs or to grow market share. And just like with Eagle Market Streets, part of what we have had to do is also scale because of the things that we have done. So we've acquired additional property in McDowell County to continue with the incubation process to help those with the startup phase get to a point where they're ready to kind of be invested in. So the gap that we're really trying to fill are the ones that they're just not ready for debt yet. They're status quo. They'll continue to make a living, but they can never grow because they don't have access to capital or training to help them get to that next level where they need to be. And I'll open it up to questions.
Great, thanks, Stephen.
Thank you, Stephen. I wondered if you could just kind of maybe share an anecdote or a kind of a story of one entrepreneur that y'all have helped just to sort of humanize kind of the challenges you're seeing folks experience, and then kind of how you see access to this equity helping folks really round the corner. You did a great job at the level of strategy and tactics. Just personalizing a bit would be helpful. Thanks.
Thank you for the question. I've got a really good example, but it'll take me a minute. It's I worked with a gentleman for about 7 years, and I came from the CDFI world, and everything we did, we tried to help him with to grow his business. He had about 4 people that worked with him. He needed many more. He missed out on contracts where he was able or could have been able to hire more people because he didn't have the capital to be able to get the equipment, the things that were needed to go with that piece of it, the growth. So he was stuck. And here's the reality of where we're at today. The worst thing that we could do if you come to me as a business owner and you say you need $75,000 and you want to buy a piece of equipment. And then I take your information, and in a couple weeks I get back with you and I say, we can't do 75, but we can do 40. And you as a business owner are going to think real hard. And you're going to think, well, 40 is better than nothing. And you're probably going to take that 40. And it's not going to be enough to get you that piece of equipment, which was the original purpose of the money. But you're going to take the 40 because that's all you were offered. And then that 40 is going to get you in more trouble as a business owner because you have no purpose to spend it on. Or it makes you make bad decisions through fintech companies that charge, 100% interest to come up with the remainder, to fill that gap to purchase that equipment. But generally, that's not what happens. The money gets spent on something completely different than what the original request was for. That's the reality of what we see. Whereas what our program is we're either all in or we're all out. We're either going to help you get to that next level, and we're going to put all of our power within our limit to help you with the capital, to help you with the resources and technical assistance, whether it be anything from marketing to some of our consultants, CPAs, you name it. We're going to put the folks in front of you that can help you get to where you need to be. So to expand on your question, I just wanted to give a little background on that. To expand on your question, we were never able to get this gentleman any financing, any access to capital. He was in our first round of funding back in July. He immediately hired five full-time people, and he was able to take part of that, and he's the one that responded to the Forest Service contract, has been awarded the contract, and it's going to be probably 15, right at 15 jobs to do the trail maintenance for so many miles within that contract portion. Without this funding, he would have never had the opportunity to be able to look at taking his level from here and not just being an employee, but being an actual business owner that can hire people that can also make a living, and take care of their families and help them grow as well. So that was a little bit of a lengthy answer, but I wanted to give you the whole story behind it, just because I had worked with him for 7 years trying to help him, and we were finally able to, and now that we were, with such a small investment. And a lot of times it's not always about the money as much as it is the technical assistance, which is why so small requests can cover so many, business owners, which is the way this program is designed.
No, that helps tremendously just in terms of really humanizing it. And I think also that 7-year period prior to this that captures the structural barriers that so many business owners face. The reason they hear no a million times and, getting to a yes opens up so many things. So thank you. That's very, very helpful.
Thank you.
We might need to hire those guys to go build some of our trails too, before it's all said and done. We'll see. We'll circle back on that. It's a different idea. So you said you've got a dozen additional companies kind of that you're working with, doing due diligence on. 7 of those are fully vetted and really ready to go. How much capital does an organization need to support those 7 organizations that are sort of ready to go?
From the first round.
And then also well, just let's start there, those 7 organizations.
Okay. So with the first round, we were looking anywhere from 60 to 75,000 per business, depending on what the requests were. We had originally thought that we would approach the business model around 50,000, and be able to work with more. But then we were just repeating the same story that I just told you about.
Right.
We were, so we sat back and really put some strategy and thought around how can we really make this a better fit for not only that business owner, but for us. Because with this program, we're not coming in as a debtor. We're coming in as an investor. So we're the last to get paid. If something were to happen to the business and it went belly up, we're the absolute last to be repaid to that fund. So we are much riskier in our position than, a traditional or a non-traditional lender. So we want to make sure, and even with what we're looking at through the financials and underwriting, in the way that we're trying to really be purposeful in who we work with, we have to make sure too that they're wanting to scale.
Yeah.
We want to make sure that they're wanting to hire folks or, acquire real property, whatever the case may be. So to answer your question, that piece of it sort of fluctuates. What we found is in this first round, it worked really well between that 60 and 75,000 range. And then depending on, what the total award would be how many businesses that we worked through. I think this particular proposal was over a 2-year period. Our goal would be to reach, 7, 8, round 1, our technical round 2, and then in the third round, we're also up for opportunity with Golden Leaf. And depending on, what that award amount is, our goal, it would be really nice because of the volume of folks that we have seen and could potentially help get to that next level. I mean, from July till today, we've helped 3 and we've got 12 more, we've got 7 ready, but the other, half dozen, they're really close to having everything turned in.
Okay, great. Other questions, commissioners? All right, well, Stephen, great job on the presentation. Thanks for being here today. Congratulations on, this is getting this is a relatively new initiative too. I know Eagle Market Street's been doing great work for a long time, but this is an exciting new initiative, and we're appreciate the chance to learn more about it, talk more about it. So thanks very much for being with us today.
Thank you for all y'all do.
All right. And last up, we got our colleagues from Mountain BizWorks. I'm dating myself.
That's right, yeah.
I a long time ago, when I had a very small office in the public service building, Greg Walker Wilson had this little office like right down the hall from me, and he's like, "Yeah, we're starting this group called Mountain Micro Enterprise Fund."
That's right. That's great.
Here we are today.
Good afternoon, commissioners. Matt Raker, Executive Director of Mountain BizWorks, formerly known as Mountain Micro Enterprise Fund, about 15 years ago. And joined by Yoslyn Gonzalez, who's one of our small business lenders and also is our representative on the Mountain Community Capital Fund committee. So she'll be helping with some of our Q&A today. So first, just want to recognize that we're here on behalf of the Mountain Community Capital Fund partnership. So this really is a collaborative request, and there's 2 public sector investors in this fund, the City of Asheville and Buncombe County, and then there's 3 CDFI participating small business lenders. So Mountain BizWorks, ourselves, Self-Help Credit Union, and Carolina Small Business Development Fund. So. So we've put this request in on behalf of the whole group. So just a little bit of background. So the Mountain Community Capital Fund, or MCCF, really aims to address a gap that we've been talking a little bit about already here today. So really around this lack of collateral and also friends and family funding barrier that's often faced by low-income founders and particularly founders of color in our community. And it's really designed to really break that barrier, and I think it's been doing that, quite well. So it operates as a loan guarantee facility. So it doesn't directly do lending, but it works with qualified CDFI lenders that are doing the lending, and it kind of expands the range of loans that they're able to make and types of financing that's available in our local market. So it was established towards the end of 2019. got a few loans made, and then there was kind of a 3-month or 6-month check-in. And then right when the pandemic happened, then then it took us a few months to get it restarted. But then it's basically been operating continuously for that after that restart period, or kind of the reauthorization that happened in early 2020. So just structurally, this kind of helps us kind of think about it. So it's a loan guarantee facility. We've got investors in that right now. We've got 2 public investors into that facility, but we've got conversations with other folks that we expect might join the program here as well on the funding side. So then that capitalizes the loan guarantee facility, that then the participating CDFI lenders can use that to enroll kind of qualified loans within that facility. And then so we work directly with the small business borrowers and really use that to expand the types of lending that we can do. So the guarantee, it provides an 85% guarantee up to a max guarantee of $70,000. And so this 85%, that's kind of consistent like with SBA's 7A program guarantee level. It was consistent with our benchmark program in Charlotte, the Charlotte Community Capital Fund that we kind of use to do a lot of R&D and putting this program together. But here's a couple examples. So if a borrower gets a $50,000 loan, the guarantee at 85% would be $42,500, and that would be an 85% guarantee. If it's a $100,000 project, you hit the max guarantee cap of the $70,000. So the effective guarantee is 70%. And then a larger project. So there's an example there of a $250,000 project, $70,000 max guarantee. It's an effective 28% one, and we've got one we can kind of get into. I mean, most of the lending that we've been doing, we've started using this facility focused on early stage, so it's tended to be on the smaller micro side of things, but we do expect that as that portfolio grows and those kind of capital requests get larger, that we'll get more and more leverage in there. We actually do have a project that's around $650,000 right now that'll probably be coming through as well, just as an example in that larger segment. So progress to date. So we initially capitalized it with a $450,000 pool. And coincidentally, as I was leaving the office today, we closed the loan that actually fully deploys that pilot pool. So that's pretty exciting. And also good timing for why we're here today, because we want to sustain the good momentum. So we've been able to support 17 different projects. So $580,000 in total lending done, and again, this is over basically the 2-year period and during the pandemic. And so we've seen some real strong growth in recent months in this. 90 and a half FTE jobs created or retained through these activities. We've had no claims yet to date, so that's great. We're excited to see that. We know there will be some losses in the fund, and we'll see as we get further into it exactly what that level is, but none to date. And there's I think some different reasons around that. One is because we're only 2 years old, but there's also a lot of intensive technical assistance and some other things that I think are working. 100% of the loans have been to BIPOC owned businesses, and 51% have been to women-led businesses as well. So really meeting, I think, the goals of expanding access to capital within our community. Startup and existing, this is something that I know we really looked at whenever we were designing the fund, not being too heavy in one, especially not being too heavy on the startup side. You can see that's about a third of the opportunities that have been funded, and then 2/3 in the existing category. And then the last point there is around financial product, innovation. So I wanted to speak to this just for a second as part of I think the real power of this facility is, so it's not just for Mountain BizWorks or the other partners to go do business as usual lending and, oh, hey, now we've got this facility that we can use. So we've really looked at this. How can we use this to really materially open the types of lending that we can do new product development on that, and have new financial tools available in the market. So we've created a new program called our Multicultural Catalyst Fund, which sits on top of the Mountain Community Capital Fund and some other facilities. But that's really a key tool that's really allowed us to kind of reapproach making lending particularly more available for early stage entrepreneurs of color in our community, and really kind of reapproaching that We've got no personal collateral required because we've got this backstop facility that helps to do that. That's a barrier, that we're able to remove. There's no minimum credit score on that. There's a real patient kind of on-ramp before they have to start making payments. Low interest rate, a BIPOC-led loan committee, just a number of things. There's integrated credit building program into that, and an integrated kind of emergency personal loan program into that too, because we know that some, data shows that there's, a number of kind of low income and business owned by people of color. Sometimes there's a high proportion that fail not because the business didn't work out, but because it was like an unexpected event that happened like in their family and they weren't able to kind of adapt and so forth. So we've got a fund that's kind of helped to mitigate some of those issues as well. So a number of different features that this program has really helped make possible. So current request on behalf of the partnership is we see this as a really unique opportunity. The timing is just couldn't be better to expand Mountain Community Capital Fund facility. So $1.5 million request. So over 3 years, that would support kind of based on current numbers, around 90 loans totaling $3.4 million in new lending in the market, 320 jobs created, retained, $4.8 million in match and leverage funds. Just at BizWorks, we've got about 900,000 sitting in our pipeline right now, so we've got a lot already, of demand there that we're excited to move forward should we be able to do that. We know that, in our local business impact survey that we published earlier this year, that funding for growth was the #1 type of funding sought by businesses owned by people of color, more than double, pandemic relief. We know that there were some real pockets of ongoing relief need, and we've done that through Buncombe and some other tools, but this is really for those helping us move in a more inclusive way, I think, out of the pandemic and really support that growth opportunity that we just heard with Black Wall Street and a number of other things that are happening in our community. I do want to mention that, we really view this as it fits very well with like the Community Equity Fund. So this is more on the lending side. In a lot of projects, there'll be a lending piece and there'll be an equity or an owner investment piece. And so they're more, we kind of look at them as like, the Community Angel Fund. That's a new great resource that we didn't really have in the community before that we can bring into projects. And then we've got this, which is providing more of the kind of lending loan side for projects. And if we look at opportunities around helping businesses acquire their real estate or do larger growth opportunities or even buy another business, where you've got to have an owner's investment or an equity portion into that, we could really see these facilities pairing very well together. And we've designed them intentionally thinking about the funding landscape in the community and making that possible. And then also, of course, with excited to continue to work with Black Wall Street around what they're doing, being an incubator and I think there's the technical side of things, which is really important about having these types of financial resources, but there's also the community and culture building that like Black Wall Street represents. I think both are really important to kind of put the whole entrepreneurial ecosystem together that we're looking to support. So again, we're really pleased to be able to share this and look forward to questions that y'all have about this program.
Great, thanks, Matt.
Yes, I have a question. Well, first of all, that sounds great. It's wonderful to hear how well the pilot program is going. So congratulations on that good work. And I'm curious, because I'm kind of want to get a sense of how long the funds are tied up with each loan so that we can see how quickly that we're able to reinvest those funds. Could you speak to that?
Yeah, hello. It just really depends on how the terms are, how long the term of the loans are. Typically, we don't do longer than 10 years.
So a follow-up question. So as they're paying down the loan, though, are you freeing up those funds so they can be reinvested?
Correct. They are, anything that gets paid back, as the loan gets paid back month by month, is going back into the loan pool, into the loan fund.
And there's also a guarantee fee that's paid at the time of a new loan being put in the fund. So that also builds up the fund over time. So yeah, but the fund does revolve. And this would be, I think, would help position the fund size more of where we think the market need is so that it would continue to revolve over time and be a really, important financial facility for us ongoing.
So I think I need a little bit more. I'm still not real clear on just how quickly those funds are getting released back in there to be utilized. Can you give us some kind of sense? I understand that it varies some, but I just want a clearer picture of that.
Yeah, so typically, like, the loans will have a term between 3 years, and kind of the longest we've seen in the fund so far is 10 years. And so as those, but really the loans will probably, they tend to pay off faster, even if it's a 10-year term. A lot of times they'll pay off faster than that. So I'd say we'll probably average around 5 years of the fund kind of revolving, into those funds coming back in and then being able to be redeployed. Does that answer your question?
Well, go ahead.
Can I
Attorney.
ask that question, Matt, as well? So yes, the principal payment goes back into the fund.
Correct.
But what about the actual loan guarantee piece? So now the outstanding loan is less because principal has paid down?
Yes.
So do you keep that 85 or 70% ratio and release?
Yes.
That's the piece that I think we're trying to clarify.
Yeah.
Yes.
So every month we look at what's the outstanding principal amount of those loans, and then so that the 85% will come down as those loans are paid back. So that happens on a month by month, and that then frees up more opportunity to make new loans and enroll new loans into the fund. Yeah. Yeah. Thanks for the clarification on that.
Question I have is, over time, how long will it take, or if ever, will the fund become self-sustaining?
That's a good question. I think we're a little bit early in the fund. We only have 2 years of data, so I don't think we know. But the Charlotte fund has been operating for 10 years now, and is essentially self-sustaining. They continue to raise capital just to expand impact, but not because it has to do that to stay sustainable. So I think that's, hopefully we'll see the same thing here.
And that's why I ask. I'm familiar with the Charlotte Fund.
Great. Yes.
Yeah.
And just building on what you raised about kind of the ecosystem that's growing around different types of support, have there been any discussions about sort of formal collaboration with the Eagle Market Street project in terms of cross referrals or ways to kind of create a pipeline of support for folks? And
Yes, absolutely. Great question. So we've got, I serve on the board of that, of the new Community Equity Fund. One of our other staff serves on their kind of technical assistance and underwriting committee. So we've got really good visibility there, and we've actually already co-funded a couple of projects in their first round, and so we'll really look forward to doing that. Just did a nice, educational thing with our staff to kind of help them understand what the purpose and intent of their fund is, so we can think about that when we're looking at projects. So, yeah, we want to continue to grow that and make them fit really well together.
Can I ask a question, Commissioner?
Sure, I will.
How about the first group that presented CityWorks? Are you working with them as well as that pipeline and helping them with that technical assistance?
Yes, absolutely. So great. We're really excited around everything that Grind and Black Wall Street has been able to do, and have supported them, and partner with them in a number of ways, and are continuing to explore in their new location now around micro retailing and how we have that pathway, because what they're doing is kind of the very early stage, but then they talked about how you link with resources. So let's formalize how we might make some of those really available. I think there's a lot of good opportunities there we're excited about.
All right, so do you know what my question is? Can you guess?
No.
Okay. All right. So my question is around, and you've touched on some of this, and I like some of the things I've heard. So like I think the last slide talked about how if 1.5 million were invested, you anticipate or you forecast that you'd make 90 loans with that, totaling 3.4 million. So some of those would be over $100,000. So I guess, I think the project is great. I mean, my biggest question and concern all along has been, with the loans of less than $100,000, how basically like you've got like an, if I'm doing the math right, somewhere around like an 75 or 80% kind of like guarantee on that, right? So even if a loan goes completely defaulted and you don't get repaid, any of it, then, I mean, overall for a portfolio like this, I mean, if I just asked, we just step back and ask, like, okay, if you have let's just say 1.5 million just for this conversation, what percentage of those loans do you anticipate would default or, or not be repaid? I know it's new, but these are kind of initiatives are around the country, right? So you can probably look at them and get a sense for what's realistic. And as you said, there will be some. I mean, that's to be expected, but it's not going to be 85% or 75% or 50%. It's going to be some smaller number. So my question has always been in the context of whatever amount of funds we could put into such an initiative. Obviously, we want it to leverage as much lending out to the small businesses as possible. But if we're loaning 1.5 million, but then, or guaranteeing that, but then only 1.8 million gets actually loaned out, if it were that amount, it's like, wow, we're not really leveraging very much. And it seems just too conservative in a way, because we all know it's not going to be, under even worst case scenarios, anywhere near that many losses. So why not be able to leverage more? So I think your answer on once you go over $100,000, the formula changes. I like that. But I guess my question is why not set that threshold at something different than $100,000, so it could potentially, whatever investment we make could potentially help a lot more businesses?
Yeah, that's a great question. Really appreciate that. So there's I think a couple of ways we view this. One, we're really using this to expand that access to capital, and especially for those kind of early stage companies where there can really be a barrier to getting access to that. And that's where the 85% guarantee, which is kind of consistent with, some of the other programs for larger loans at that amount, that really opens up the amount of the people in our community that can effectively start and grow businesses. And I think building that we've seen that building that portfolio is a pathway to getting the broadest, most inclusive kind of local business environment that we want to see, and that we'll start to get more and more leverage over time. But I think that's where we've got to start. So that's one thing, is I think it actually does help us long term be able to leverage more by having that tool in place. The other thing is that there are some other facilities like the SBA program, which we can leverage for guarantees for larger type loans as well, that's already there, so that when someone can kind of transition from this fund and they grow to that next level, could get to that next fund. So I actually, in terms of, I think the impacts, the kind of, the mission impacts and the equity impacts we've got designed with this fund, I think that's what we're maximizing that a little bit more, and maybe a little bit less on the financial leverage. But over time, I think we'll grow more, we'll do that. I think this is something too for the committee to evaluate over time as well, as it gets a little bit more seasoned and we understand what the performance is. Because if losses ended up being in the, who knows, 10%, 15%, I hesitate to put out a number because we don't really know, yet.
So let me ask you this. So are these decisions that are sort of within like your organization, and I know there's a number of different organizations there, but like with the local organizations, are these some decisions that are within the local organization's purview to set some of these policies, or in some ways are your hands just completely tied by your other lenders, and therefore, even if you wanted to change it, either now or in a year or two from now, you couldn't change?
The Mountain Community Capital Fund board would probably have to go back to its core investors, who kind of established the bylaws for it, where the guarantee thresholds and everything is set into place. But I think they could certainly look at that and make that recommendation.
Okay.
Yeah, and we think that's definitely something for us to continue to look at over time. As we're coming out of the pandemic, we don't think now is the moment to change that, especially because we've got other kind of products that are built on this that don't have to be redesigned and some other things like that. But we think definitely that's something to look at down
Okay.
the road.
Well, so just tell me, I think this is a great initiative, but let's say we are a year, 2 or 3 out from here, and what you see is that it really is a self-sustaining fund, right? It's, you have some losses, but you also, because of fees and interest and stuff, let's say it is really, looks very self-sustaining. Do you think it's realistic that then you could say, let's revisit these formulas? We could safely lend out quite a bit more, knowing that with this diverse a portfolio as we have, there's no way we're going to end up like having all this principal, this reserve fund, be consumed.
Mhm.
Is that realistic? I just want to kind of like, I think this is I want to kind of think about what's the long-term vision for how this
I think it's definitely realistic, and we've already started having some of those conversations, with the different lenders and the other folks on the committee, and I think, within a year or 2 years, I think this is something we definitely want to revisit and see where we're at, and are we really, because ultimately we want to maximize the amount that this helps get more financial resources into the community. I think right now it's working tremendously and unlocking a lot of opportunities that we didn't have before, and that the guarantee where it's at right now really helps make those deals happen faster, more confidently. We can be a little bit more creative with some of the other, tools, the credit building and the technical assistance and those sorts of things that go around with those. Yeah.
Great. Commissioners, other questions? All right, thank you both for being here. Thanks for your great work on this proposal and everything else we've been working together on through the last many months. Thank you so much.
Thanks very much, all.
All right, Commissioners, that's the last of the Recovery Act proposals we had this evening. I'll just want to kind of announce, for the organizations that are here this evening, as well as just for the larger community, it is our expectation that the Commissioners will make an additional round of decisions around allocations of Recovery Act funds at our second meeting in November. So that'll be the third Tuesday in November. We don't know how much the Commissioners might allocate at that meeting, but we do expect to be prepared at that point to make some additional decisions around the proposals that we've received. So we appreciate everyone's work with us on that. All right, that concludes our agenda for this meeting. So let's adjourn, and we'll start our regular meeting at 5.